Welcome back to Check Up with Bluegrass. I'm your host, Rob Stromberg, Cardiology Service Line Director and Safety Officer at Bluegrass Community Hospital. I'm very excited today about our podcast. We have someone exciting to talk to us today, share some wonderful news. So today we're going to talk about something that affects so many people in our community. And if you can guess what it is, it's our eyesight. So joining me today is Dr. Dudee, that's D-U-D-E-E, an ophthalmologist who specializes in cataract surgery and overall eye health. Dr. Dudee, thank you for being with us today. It's a pleasure to have you. We're going to kind of lay a little bit of foundation. Really just start with, tell us a little bit about yourself and what led you down the medical career pathway of ophthalmology.
Well, great. Thank you, Rob. And it's great to be here. Delighted to be working in Versailles, and the hospital team here is fantastic. But back to my interest in ophthalmology and eye care. It started a long time ago. I like the aspect of where you can make an immediate improvement in people's lives. Eye surgery or ophthalmology in general, it incorporates the arts and the sciences as well as medicine. And as I said, you can see a tangible difference, and it's my passion.
Excellent. I'm an artist, I kind of do that on the side. And one thing I do admire and kind of focus on a lot are eyes. And so a lot of people kind of notice that about my artwork. They're like, man, like you really capture the eye. So you mentioned that it's something that's a part of us that drew you in, obviously. So excellent. So I'm going to lay a little bit more foundation on the subject of our eyesight. What exactly is ophthalmology, and how is that different from optometry?
Excellent question. Optometric doctors or ODs are specialists or experts in vision care. They will. Most people see them for glasses, for contact lenses, and they screen for eye disorders. And so, as far as eye care goes, most of us will see an optometrist first. Ophthalmologists are medical doctors who, after medical school, will do at least 4 or 5 years of specialized training in eye disease and surgery. So I sometimes use the analogy of a sports team. Your optometrist is your skilled, hardworking coach who keeps your vision sharply focused day to day, and the ophthalmologist is the medic who runs on when there's an injury. So, but together they work as a team and keep you seeing well.
Excellent. I like the analogy. That's awesome. So we're going to move into, we're coming out of summer season here, and oftentimes we are with our families, family vacationing, family reunions, community events, and we're empty nesters now. And so a lot of these conversations end up going down the avenue of medical conditions and things I have going on. And most often people start to talk about cataracts. And so what are cataracts, and how do people know if they might have them?
Another excellent question that I get asked quite frequently. If you think of the eye as a kind of a camera, then a cataract is a gradual, natural clouding of the lens that develops throughout age. It's common, it's painless, and because it affects both eyes, most people, or people in the early stages at least, don't know that they're developing cataracts. And it is one of the most common causes of vision loss. By the age of 80, most Americans have either had cataract surgery or have cataracts. And the symptoms are, they're different for each person, but typically they report blurring of the vision. Colors may not be as sharp as they were, so that bright red barn isn't bright red anymore. Maybe people need more light to read, and one common condition or common symptom is difficulty with night driving, particularly glare and halos, or discomfort with oncoming headlights. So it's it's almost a natural condition. I sometimes liken it to graying of the hair. It happens gradually, but you notice it one day.
Yeah. Well, you made me a little nervous, unfortunately, because I've noticed even with myself, I do see better with light. Because I officiated a wedding one time, and I wear readers, but if I'm in the direct sunlight, I can read just fine. I don't need my readers. So I do notice that lighting definitely affects my eyesight. I can see a lot better. And then for me, I thought it was just me driving at night, and I hate driving in the rain at night because of the additional glare on the window. So I'm glad you said it, but at the same time, it sounds like something that just happens as we naturally get older. Our eyesight tends
Correct,
to kind of
yes.
diminish as well. So, all right, great information on that. So if someone does have cataracts, I'm not speaking that into my life at all. How is cataract surgery performed today? Is it as big and scary as some people may think about surgeries? Should I be super anxious about it? Tell us a little bit about what that looks like today, having cataract surgery.
Well, I think any surgery is scary if you don't know what to expect. But cataract surgery is one of the most commonly performed surgeries today. And for the right candidate, it has almost 100% success rate. We do surgery at Bluegrass Community Hospital, and it's outpatient. There's light sedation, numbing drops, and people are usually in and out quickly, and I usually get really good feedback from my patients about the team here, how everybody's kind and efficient. And so I wouldn't be... I would get your eyes checked. I wouldn't worry about whether the surgery is scary or not, but it has a very high success rate. And one of the most gratifying things about my job is seeing the patients after the surgery and the look on their faces. A lot of them tell me they haven't seen that well since they were children.
Yeah.
And get a lot of amusing anecdotes about it, how they didn't realize their floors were that dusty, or or what their spouse looked like.
Well, that's excellent, because that kind of segues right into the next question, is that many people do say that after cataract surgery, their eyesight is far better than it was in the previous years. So you've already spoken to that a little bit. So that's very true, because you said mostly it's almost 100% pass rate, correct? Or not pass rate, but success rate when they have these particular types of surgeries.
Yes. For the right candidate, it's almost 100% improvement. And as I say, because it's gradual, people don't realize how much the cataract was interfering with their vision. And a lot of the time, people adapt, or their brain adapts to the reduced vision, so they didn't realize how much they were struggling, and see things that they're not used to seeing.
Yeah, that made me think about my dad. He's already had some eye surgeries, but I didn't know if it was like something from military past that he was having some difficulty with, something from his childhood, but he just kind of dealt with it, and I see a lot of individuals in the community just kind of realize, like, I'm tripping more, falling more, I burning my food. Sometimes it can be a risk factor, right? Because they're not, they're just like, oh, I'm just aging.
That is an excellent point, because I think people do sometimes just think of vision problems as just affecting vision, but things like, as you mentioned, falls, depression, social isolation, I think even dementia or cognitive decline can be accelerated because people aren't getting that stimulation through books or reading. So that is an excellent point.
Oh, I appreciate it, yeah. I just noticed that you just look at him like he's closer to the TV, right? And like you said, they don't read anymore, and he was playing on the guitar a little bit, so he stopped doing that. So it's like little things that I think family members can pick up on when they see their loved ones gradually pulling away from things that they used to see them enjoying. So great, I'm glad you shared that with us, because those are the kind of subtle things I tend to pick up on when I'm around people. It's like, you don't do that as often as you used to. And like you said, then depression comes in, then they start their isolation process. And so I think as family members, we need to kind of pay attention to that and notice if our loved ones are starting to kind of pull back from the things they used to enjoy doing. We're going to step outside the box a little bit in terms of cataracts, and we're going to talk about other eye conditions that you may see very often and that people should be made aware of. What would that be, Doc?
Well, there's some big ones. One is glaucoma, and that's an underdiagnosed condition. It doesn't give symptoms in the early stages. It leads to, unfortunately, in the advanced stages, irreversible vision loss, and that can be picked up by a regular eye exam. And it's common. Probably 5% of people over 65 have it. Half of them probably don't know they have it. Diabetic eye disease is the most common cause of vision loss in working age Americans. Again, to a large degree, can be prevented. Macular degeneration is very common, and again, prevention is better than cure for that. And then common things like dry eyes, allergies. We see a lot of that. So there's a lot of eye conditions which, if they're caught and treated earlier, then people would be enjoying their vision better.
Yeah, I appreciate that because I know I deal with dry eyes, and we are in Kentucky. Allergies are always an issue here. If you move to Kentucky from another state, it's like, man, like I'm always choked up. My eyes are dry, and it's maybe more on the line of optometry. But could you kind of just briefly, what is a good eye drop if you're someone who's dealing with dry eyes? Can we just grab something off the counter, over the counter, so to speak, or do you recommend that we see an optometrist first, and then they may, in fact, turn us on to you as an ophthalmologist?
I think there are a lot of good over-the-counter artificial tears, several different brands, and I don't think any particular brand is better than another. Some people, particularly those with allergies, prefer one that is preservative-free, and most of the brands come in a preservative-free version. And there's also other factors with dry eyes, medications, medical conditions. So there's a lot that can be done for dry eyes. Unfortunately, it's another condition that people tolerate, put up with, which they don't necessarily have to. And it decreases your quality of life. It does make a big difference in people's day-to-day activities.
Okay, thank you. Appreciate that because I do struggle. The struggle is real, doctor. So preview to this or having this podcast, I did read a little snippet on some facts, and this is coming from the CDC. It's a 2024 report. And it said because of the U.S. aging population, we talk about baby boomers retiring and different things like that, and those with uncorrectable vision impairment, it says this is going to more than double by 2050. So how often should someone get an eye exam?
Well, I think most children should be screened, or they are screened soon after birth. After that, most adults should get an exam every year or two. And more frequently if there's family history or medical history of diabetes. So every year or two.
Okay.
Is a good recommendation.
Because I know women get mad at men oftentimes. They're like, they don't ever go to the doctor. So I love the dentist. I hate the hygienist. This is me. But then, like, when we talk about vision, it's like, yeah, we normally don't go until we start to see some issues. And then sometimes, like I said, it might be a little too late. So 1 to 2 years is when we should get our eyes checked.
Right.
Okay.
Right.
Good to know. So we're going to stay outside the box a little bit on cataracts. Let's talk about something that is always out in the marketplace. And we're talking about lifestyle now. And are there things that people can do that's day-to-day to protect their eyes?
Yes. So the one that comes to mind first is UV protection, sunglasses.
Okay.
UV light is bad for our cataracts or macular degeneration, and even skin cancers around the eyelid, like basal cell carcinoma. I think regular visits with your primary care physician, your optometrist, ophthalmologist, to pick up those preventable causes of vision loss. That's important. Good nutrition,
Mm-hmm.
so green leafy vegetables. Uh, 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 we also talked about eye protection. So fortunately, I'm seeing a lot fewer eye injuries
Okay.
than in the past because people are more conscious about wearing goggles when they're working in their garage or on projects. Um, and getting your blood pressure, cholesterol, sugar, all those things checked by your primary care physician.
What about, because we're in an age of technology today, and a lot of people are in front of screens. So children, especially now, have tablets as early as probably 3 years old. So they're gaming. Children are gaming. We're sitting in the workplace in front of the computer screen. I know sometimes there's those tinted lenses that are yellow or blue. Talk about that. So how does that impact eyesight when we're constantly in front of a screen?
Well, many studies show that nearsightedness seems to be increasing a lot amongst kids. And that seems to be associated with not being outdoors, doing more close work. And so I encourage children to go for a walk, go outside, get some sunlight, and rest your eyes every few minutes. Looking in the distance, not focusing close up, and just taking a break.
Okay. No, so good nutrition. Are carrots really good for your eyes?
Well,
I'm trying to eat more carrots, Doc.
well, there's things like lutein in carrot, which is good. So colored vegetables, peppers, and especially green leafy vegetables like spinach.
Okay.
Those are great for the macula.
Good, because I'm trying to move that direction, eat a little more like Mediterranean style diet. So good to know that's helpful in the nutrition. So here we go. For someone who's listening today and may listen later on, who haven't had their eyes checked in a long time, what would you say to them?
Well, I would say, look, your vision isn't just you seeing the world, but it basically interprets the best moments in your life. Seeing your grandkids' faces, seeing the beautiful rolling hills that we see here on Sunday Drive, curling up with your favorite book. All these things are our connection with life, and it's important to protect that. And fortunately, there's a lot of help out there to help us keep good vision.
That's important because, I noticed that we talked about baby boomers, those that are retiring, and most, when they reach that level in their lives, in their season in their lives, they travel. And I know that when they travel, they want to see these great sights. And so you mentioned that it's helpful to get your eyes checked if you haven't done it in a long time, because we talked about now you can get back to those things that you used to enjoy doing. You get to see, oh, my wife is actually very pretty, right? And I can see my grandkids now, but now I can see these rolling hills. Now I can see the Mediterranean Sea, or I can enjoy this wine I'm drinking. That's good to know because as people want to get out there and enjoy life, we talk about lifestyle, but oftentimes that generation starts to travel more. So yeah, I think it's helpful that if you can have improved vision, you can really enjoy the moment. So I appreciate that. And even go back to look at some old pictures. So thank you, Dr. Dudee. I've enjoyed this podcast today. You've given some excellent, great advice. Is there anything else you would like to share with our viewers today or listeners that might be helpful moving forward, things you've seen and where it's headed in terms of technology? And you mentioned that you said nearsightedness is actually decreasing now.
It's increasing amongst children.
Children.
Yeah. And that seems to be associated with close work. And we talked about the cataract surgery in the team here. There's technology now where after cataract surgery you can have better vision than you did before. And sometimes not even need glasses, not even bifocals. So that's exciting, and it's that improves people's lives. But at the end of the day, technology is fantastic, but it's the human team that really sets us apart. And I want to shout out to the team at the OR in the hospital and in my office.
Well, I'm glad you're here, Dr. Dudee. Thank you again for sharing this helpful information with our listeners. And thank you to our listeners for tuning in to Check Up with Bluegrass. So for more information on cataract surgery or anything about healthy eye and eye exams, visit Bluegrass Community Hospital online or give us a call at 859-873-3111. So until next time, take care of your health and most importantly, your vision. Thank you.